So Donna, you're here this morning 4 weeks after your right foot surgery, right?
Yes, I am.
So, and I'm going to show in the video, this is obviously your incision.
Okay.
So you had a very large bone spur,
Yes.
arthritic bone spur on top of your foot.
Yes, I did.
Well, tell me the story, how long you had it for.
Well, it's a story that I was outside watching my husband do some work, and he dropped a 2x4 on my foot.
Okay.
And I didn't, he didn't even know he did it.
Okay.
But over the years, I guess the arthritis, the bone spur, and I just kept putting it off and putting it off. But I couldn't really do my daily activities without having a lot of pain and swelling in the foot.
And swelling, right.
And a friend told me about you, Dr. Wellens, and I said, oh, I've got to go get this bone spur taken care of. And so when I came, you told me what we could do and what my options were, and it was
because
been great.
because we did a CAT scan on you.
Yes, yeah.
And with a CAT scan, with a weight-bearing CAT scan, we really can see, the extent of it. And basically, you had post-traumatic arthritis and a bone spur, and it was pinching on all the nerves and tendons. So
very painful.
Very painful. So I did a procedure where I went in and I removed the bone spur, and we had an option of fusion, but we kind of agreed on not having it done because with the fusion you have to be off your foot for 6 to 8 weeks.
Right.
And with the surgery you walked out of the operating room, right?
I did.
And even looking at your foot right now, I mean, you're 4 weeks out, you still have some swelling, but I can tell you, as in a year, you wouldn't even have a scar.
Right.
Right.
Good.
And I'm going to ask you my favorite question. So, how much better are you percentage-wise?
I believe 100%.
100%. So your pain is completely
gone? I still have some pain. So I guess maybe we should say, 99% or something. But yeah, I do have the pain, but it is not what it was.
No
before.
sharp stabbing
No
pain.
sharp. No.
And remember, you're only 4 weeks out.
Yeah.
So if anything,
I'm
it's only going to get better, right?
Yeah.
So, well, good job. And
thank you. I did everything you told me to do.
Well, yes.
So
well, that's why you're a top 5. Well, that's why I'm doing a video on you, because you had excellent results, because you followed all the instructions.
I did.
I mean, pat yourself on the back.
Thank you.
Because you would be surprised what I see, right? You do the surgery and then people do nothing you tell them to do. So
the hardest part for me was not to go barefoot.
Of course.
Walking.
Of course. And you still have the dressings, you still have to follow the protocol.
I did.
So I always tell you, I do my 50%, the other 50% is you. Of course.
Yeah.
Absolutely.
Thank you.
It's teamwork.
Thank you.
So, well, it's been my pleasure, and I'll see you in a couple of months for a final checkup, okay?
Sounds good.